A doctor reviews a new anti-obesity drug made by Arena Pharmaceuticals to see if it's safe and effective. He later publicly states that the drug should not be sold to the public. Arena stock goes down. Then, a man who supposedly invested in the drug physically threatens the doctor. We brought you the story yesterday. Now there's more. Stephen Greer broke the story. He's the CEO of the Healthcare Channel online network, and he's with us today. This doctor who turned down this obesity drug in an FDA panel situation, how was he threatened?
Well, it's a little broader than that. First, the FDA documents themselves were negative, and the stock took a big crash even before these group of outside advisors showed up. Then during the panel, there's at least 15 different doctors, and he was just one of them. But he's the most vocal, respected one.
Was he physically threatened?
Yes, and I can't say his name for security reasons.
Understood.
Because this morning there were threats made on our site about him.
Really?
And by the way, the name Arena, that's the first time that's been announced today. That's been
that's
a bit of a Fox Business scoop.
I kind of guessed that was it, though.
But here's what happened. He after the meeting was over, he went into the hallway. These are held in hotel rooms, like a Holiday Inn. And this irate person came out, and he described him as, I know this community really well because investors go down to these meetings and they can sit in the audience. And he described him as about 40-something in a nice suit and so forth. And he said, "You're a pompous expletive. You were wrong." And he said, "You'd better get out of here." And the doctor thought it was a practical joke, but then he repeated it again. So then the doctor called the security. They have him on a video camera. And the FDA, to their credit, took it very seriously. The next day, there was another different panel, and the doctor had 2 security guards shadowing him to the bathroom and everything.
But what you've revealed is pressure in 2 ways. There's a physical pressuring threat here, which you've just described. The other side of the fence is there is the bribery option. Doctors could be offered money. Approve this. And some of the doctors, I believe, in the old days, used to take money from drug companies whilst they were sitting on these supposedly independent panels.
Oh, that's a huge problem. They've only recently made changes there. They still make a ton of money by being on those advisory panels. They get consulting fees afterwards. I can go into that in a whole different segment for you. But that's why the FDA is getting harder on financial disclosures. Yes, doctors in the trials getting paid tens of thousands of dollars would be the same ones voting. So that's a bias in one direction.
But that doesn't happen now.
It still does, but they're cracking down on it.
And then does? It still happens? I thought that was out of bounds. You couldn't do that.
They just made the disclosure stricter, but there's still plenty of conflicts existing. And it's the whole issue. Now, and then if you're on the other side, and if you're too critical of it, then you've got investors and drug companies that will pressure you, in this case, threaten you. So when it involves a small cap stock where the outcome is, that's where you get a lot of emotion. If it's something like Genentech is now part of Roche, no one cares about Avast anymore because it's part of a Swiss company. So when it's these small cap companies, that's where you get these extreme.
Stephen Greer, you got the story and you told us it, and we appreciate you being with us. Stephen, thank you very much indeed, sir.
Thank you.
Got it.